Today
So,
is Tuesday, July 14th, 2020. My name is Jackie Pelota, and I'm here interviewing Christopher Mercado for the Voces Oral History Center at the University of Texas at Austin. Please know that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there is anything you do not wish to talk or answer, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we'll talk about it. Because we're not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 2 questions we need to make sure you agree to before we go on. So Voces wishes to archive your interview along with any other photographs and any other documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. Do you give Voces consent to archive your interview and your materials at the Benson Library?
yes, I agree.
Do you grant Voces copyright over the interview and any material you provide?
Yes, I agree.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes, I agree.
Awesome. So we have many questions in the pre-interview form that we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server. Before we send it to the Benson, we would have stripped out any contact information for yourself or family members. So that will not be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview in your public file available to researchers at the Benson?
Yes, I agree.
On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or your email with journalists?
Yes, I agree.
Awesome. Thank you so much. So I know that that was long, and I appreciate your patience. So we can just get started by having you share a little bit about yourself, you know, your background, family, work, things like that.
Okay. So my name's Christopher Mercado. Everybody calls me Topher. I was born in New York, came down to Florida around 1996. I'm of Dominican and Puerto Rican descent, in part to my father and mother. I have 2 older siblings, a sister and a brother. I'm a registered nurse right now. I used to work in the acute care floor, but now I work in psychiatry. And I'm just about finished getting my master's in the science of nursing to become a nurse practitioner with a focus in psychiatry. I've been living in Miami ever since 1986. I've traveled a lot, but I've never established myself anywhere else. So I feel like I'm a true Miami native in that aspect. Um, I attend Florida International University, getting my master's and my doctorate at the moment. And once that's done, I'm hoping to transfer what I learned there to help the LGBTQ community in telehealth and have access to care for people who may not have that direct access either because of COVID-19 right now, or because of a rural setting, or just because of lack of access due to financial reasons, travel reasons, etc.
Awesome. Thanks, Topher. So you said that you were, or you are a student. So did you finish the semester? Did the semester end for you already?
So the semester ends, I think, in 2 weeks. Yeah. So I already finished my exit exam. I already finished the bulk of the assignments. It's just waiting out the last 2 weeks. I am rewarded my master's right now at the end of July, and next year, December 2021, I would be getting my doctorate in nursing practice.
Well, congrats.
Yes.
That's really awesome. I'm sure you're super excited.
So excited.
So how was that transition, kind of thinking about, the semester, how, before COVID, you were, engaging with folks in person, and I'm sure things had to change once the pandemic started.
Yeah, of course. So I think the pandemic struck halfway through my spring semester. So I was going to see patients in a clinical site, and COVID really disrupted all that. So we were moving towards telepsychiatry or telemedicine in order to have that face-to-face contact with patients. And throughout this semester as well, we've been doing telehealth, where we see patients either through video conferencing, like we're doing right now, a phone call, or other means in order to conduct the interview and see how the patient is doing with their medication management and their therapeutic therapy sessions. It's been a struggle because a lot of people may not have like smartphones or a laptop with stable internet, but we've been able to manage. And for the cases that we do have to bring them into the clinic site, we take all precautions. They wear a mask, we have social distancing in place, and we don't allow too many people in at once. So it's been a change of pace considering clinics usually are packed like sardines, but now people are realizing that we need to have social distancing and we need to have this sort of communal effect to it, where we have to take care of not only ourselves but those around us, and we have to respect that as well. So it's been challenging but rewarding at the end of the day.
You say that the, switch to more telehealth has been well received by, people in your program or just patients in general, since I'm sure maybe it's newer to some of the folks that you all were engaging with?
Yeah, so the benefit of telehealth is everybody is used to like Skype or FaceTiming. So that transition was smooth for them. It was conducting an interview and being receptive for the other person. So say I am new to the patient. They've never met me before. They may be a little bit apprehensive to engage in telehealth in that aspect. But if it's been a patient that's established, we built rapport already, they feel more comfortable with telehealth because they know who the other person is at the end of the line.
And do you think that just this increased use in telehealth, you think that this, will stay kind of from your professional perspective, or, do you think that, it'll be used a little bit more widely?
So I think telehealth, telemedicine, however you want to call it, has been around for a while. It's just COVID accelerated the process and the necessity for it. So we're seeing it in a grander scheme. Before you would see the focus in psychiatry and maybe primary health. Now we're seeing it across all forms of healthcare. And I think it's gonna stay only because it's so accessible. And now the Center of Medicare and Medicaid and other forms of insurance are covering telemedicine and covering that level of face-to-face care that they may not have covered to the extent that they are now. So I think this is something that we're progressing towards, and it's going to be around for a long time because it's beneficial for all parties involved. I'm actually um, doing a project right now for school in terms of the pros and cons of telemedicine. So the pros list is again accessibility. You reduce risk of infection because you're not face to face, so there's no like if I cough, I'm not going to infect anybody. Um, Reduced cost for people. They don't have to take a day off from work. They don't have to travel somewhere, drive somewhere, um, like spend a whole day just for this clinical site. They could just take maybe half an hour to an hour out of their day at the job site or at home, have their interview, and be done with it. Um, the only repercussions around telehealth, and there are obvious signs that they're improving with this, is breach of security and privacy. We have to abide by HIPAA laws all across the United States and ensure that our patients feel comfortable expressing their thoughts through a medium that is new for them. Another factor that could hinder telehealth for some people is like right now, you see the upper part of my body. say I'm nervous or I have anxiety and my foot is tapping, you won't be able to see that. So that's a part that limits us. But in time, we'll be able to progress and see where we can help improve on our limitations with telehealth. But I think it's going to be beneficial for so many people because it reduces their risk to go to a clinical site that they might not need to go to the ER, to go to the hospital when they can get their symptom management done online with ease.
That's super cool. Yeah, I mean, that's really, really cool that technology can be used in that way. So you also said, on top of being a student, you also said that you work. And so, I would love to hear kind of how, COVID and the pandemic has impacted your workplace and just what your work looks like right now.
Yeah, so when the pandemic hit, we saw the census of patients decrease dramatically. People did not want to come into the hospital for any reason. People viewed hospitals as a hotspot for COVID, thinking and perceiving that if I go to the hospital, I'm going to catch it from someone or something and I'm going to get sick. So let me just avoid it completely. But as more information has come out, as more guidelines have been brought forth, where social distancing, face coverings in the form of cloth masks, surgical masks, or any form of face shield, and hand hygiene plays uh, plays a role in the reduction of spreading this illness. So with all this, people are starting to come back into the hospital, and right now we're seeing actually surplus of patients with deficiency in staff because a lot of people, unfortunately, staff members are getting sick with COVID and are restricted from coming in because if not, they'll just be spreading the virus even more. Um, in terms of the patients on the psychiatric unit, we've had, I want to say, less than 10 patients total who are COVID positive. We try and do testing for patients who show any sort of symptoms. Ideally, you would do the testing initially in the ER, but um, due to budgeting and due to staffing, that might not be accessible for them. Patients have been really receptive. They have been wearing their masks as often as they can. Um, they've been washing their hands. We supply them with soap, with alcohol dispensers at the nurse's station. And they've been really good in that. The only hindrance in terms of patient distancing is unfortunately we still have 2 patients to a room. We don't have space to allot 1 patient per rooms, but hopefully in time we can give them their space so we can help reduce more of the spread of the infection.
So you said that you've seen, a significant increase in, staff potentially getting sick or just being understaffed. I guess what would you say the general feel is in your workplace or where you work in terms of safety? Like, do you feel safe? Do people feel safe? The specifically like the workers, not necessarily the patient.
Initially, there was this whole back and forth between administration and staff in terms of what's appropriate to wear, what's not appropriate to wear. I think around March, they were saying don't wear masks because you're going to increase anxiety in the patients. And then as more information started to come out, they retracted that and said, okay, now everybody has to wear masks because it's decreasing the spread of the infection. Um, the morale right now is unfortunately low. We are working at unsafe ratios. I have some friends who are working the critical care unit, intensive care unit, and acute care unit that normally they would have 1 to 2 patients per nurse, now are having 3 up to 4 ICU, like intensive patients per nurse. And that's just incredibly unsafe for both staff and patient. In terms of psychiatry, there have been days where I have had 10 to 12 patients where maximum we are supposed to have 8. So the level of care may not be there only because there's just not enough staffing. Um, Something that I wish my hospital would do, and I think every hospital should be doing, is testing their staff on a weekly or bi-weekly basis. That way we just know when someone is sick and we can limit their exposure or limit other people from being exposed to this and potentially wiping out the rest of the staff force, because this virus is insidious and it does not discriminate. It we As much as we know now, 4 or 5 months after the fact, we still know so little about this virus, but hopefully in time we can further adjust our approach to it and help combat it as appropriately as we can.
You had mentioned that you wish that your employer, was testing you all maybe with more frequency or just at all. So, what happens like if you all wanted to get tested, or what is it that you all have been doing?
So there are a lot of community outreach centers where you can get tested. I worked or volunteered rather, the Florida International University Tamami testing site for COVID, where I was doing testing on patients, redirecting traffic for the patients that would be tested, and doing the calling center. So that's where I've been referring a lot of my coworkers to, and a lot of friends and families that want to get tested. There are also other locations around the hospitals that you can get tested. And if for some reason you display symptoms, you can go to the ER and get tested there, but the results don't come back as expedited as other places would be. The drawback of that is, as we know at this current time, more than 90% of those who have COVID don't show any sort of symptoms. So it's counterintuitive to only be testing staff members who are displaying symptoms when more often than not, people are not going to be showing any sort of symptoms, or their symptoms may be so mild that they might just say, oh, this is just like a cough. It's not a big deal. But at the end of the day, it could be COVID. So I wish the hospital would be testing us both for antibodies for active infections on a more frequent basis in the hospital, and not just tell us, hey, you can go to a community center and get tested there, when we're healthcare workers. You would think that the hospital we work for would take care of us directly, but unfortunately, that's not the case for a lot of places.
Yeah, that sounds very. So, based on what you said, have you or have somebody have some of your coworkers brought your concerns as healthcare workers up to leadership or management, and then how, if you have, how was that received?
So our direct management, like our director and manager of the psychiatric floor, has been great, but unfortunately their hands are tied in what they can do for us. So then we take it a step above, and like the CEO, CNO, CFO, the chief officers of hospitals really aren't engaging directly with staff and telling us, hey, this is a course of action that we could be potentially taking to protect you, the patients, and your family. So really, to answer your question, administration hasn't really been doing much. They haven't really been assertive in helping their staff, unfortunately.
Have they provided you, if they're not providing you with tests, have they provided you, with PPE? Have they provided you with, if folks, like you mentioned, some people are being sent home, are they being sent home with, the paid leave? How have they maybe helped, or at least potentially tried to help in other ways?
So um, they've been supplying us with masks once they started to enforce that all hospital staff must wear masks. And as of 2 weeks ago, they've been supplying us with face shields, just for added protection. When we do testing in the hospital setting, they offer us with the gowns and other forms of PPE to protect us. They're the masks that they supply us are surgical masks, level 1 or level 3. There are some that get the N95 mask or the KN95 mask, but just like other hospitals, we are in short supply of that right now. A month ago, I would say we were sufficiently stocked, but right now, with the spikes that we've been having here in Florida and all over the country, we've been depleted. So it's been tough in that sense. They've been unfortunately not as helpful with patients. With patients come in, they get one mask in the ER, and when they get discharged, they could potentially ask for another mask in the front entrance of the hospital. I wish we would be able to supply a fresh mask every single day for every patient, but the numbers aren't there. We just don't have the supply for that. Sidetracking that, I'm actually working with some friends right now to create flyers to ask for donations for cloth mask and reusable masks for patients to hopefully reduce some of the spread of infection, because a lot of the patients that come to the hospital, at least in the psychiatric unit, are homeless or indigent. A lot of them are Black, Hispanic, and they don't have the financial security to have a place to stay, a place to eat, a means to have proper facial coverage. So I would love to help them out. And although one or two masks may not make too much of a difference, at least it can give them a sense of security for themselves when they get discharged or while even in the hospital when they're there. I wish we would be doing more, we could be doing more, but unfortunately, the way the current administration of the government has been handling this pandemic, it really sidestepped every single level of care all over the country. And we're seeing the frustrations in nurses and doctors. We're seeing burnouts at a more exponential rate now than before. We're seeing mental health concerns with people who all they're doing is going to work and going home, going to work and going home. They don't have that coping mechanism of seeing their friends or going out to a park or to a beach, just because everything is mandated to be closed or is just not safe enough to go out right now.
You had started sharing, some of your thoughts as it relates to this current administration's response. So could you maybe speak more to that, more to how you think the administration has specifically handled the concerns of healthcare professionals, like yourself, that are working at the front lines?
Um, I think it all boils down to how they approached believing the virus. At first, they were minimizing it, saying, "Oh, it's just like the flu. It's not that big of a deal. This is gonna pass. This is like H1N1. A lot of people didn't die from that. We'll survive it." And that really spread the message to everyone, saying, "Oh, it's not that big of a deal. I don't have to worry myself." Um, in relations to healthcare workers and policymaking, I feel the healthcare workers would have been better adjusted if they initially just stopped everything. If they mandated a stay-at-home order, they did a freeze on foreclosures, on rent, and supplied everyone with a universal basic income just to sustain themselves with medicine or food or any other necessities that they may have. And that could have dramatically decreased the spread of infection, and that would have dramatically decreased the amount of patients having to come into the hospital for COVID related symptoms or management of other sort of infections related to this virus. So if they would have done all this in the beginning, the hospitals would have been better alleviated. On top of that, comparing to how other countries initially tackled this, they were doing contact tracing where, say, you and me, we have our phones, we have an app for it, right? Um, I was in contact with someone that has COVID-19. The app will tell me, hey, by the way, you were in contact with someone in the last 2 days. You should go get tested. And then anybody that I was in contact with in the last 2 days will also receive a message. That way we can help reduce the spread and get proper testing expedited instead of waiting for it to develop and get worse and potentially infect other people. So I wish our administration, both at the federal level and at the state level, would have handled this better. And that's where I feel, in terms of policy and politicians, when you are creating regulations surrounding healthcare, you should have experts. You should have an epidemiologist. You should have an infection disease doctor. You should have scientists and researchers who are focused in this field and take their word and their research and their evidence at face value and understand that this is something that they've dedicated their lives to. This is who we should be listening to and respecting, and not just see what's going on in terms of economic disparity and disposal. We should be looking at this country in terms of health. And without a healthy population, we are not going to have any sort of economy, as we're seeing right now. The current administration boasts about having an increase in, I think, 9 million unemployment in the last month. But at the end of the day, there are still maybe 30 million people who are unemployed. There are still 34% of people who are not able to pay for their mortgage or their rent. And I think 28 to 29 million people are at risk for homelessness in the next 3 months because of this crisis. All of this could have been avoided if we had a better response back when we first found out about this virus, whether some say it was in February, in January, or early as December. And on top of that, also, I wish the current administration would not have eliminated the pandemic response team back in 2018, because they could have caught this a while back, the same way they caught H1N1 and Ebola and so many other potential pandemics or epidemics, and significantly reduce the widespread infection that we're seeing right now in this country.
Thank you for sharing that. And, you talked about the spikes that you're seeing in Florida. And I know when you were speaking about the administration, I guess you were talking mainly about like the administration as a whole, but many would say now that Florida, especially South Florida, is at the epicenter, right? Of the pandemic. And so, what are your thoughts and feelings, especially as a healthcare professional, about how the governor specifically has handled things in Florida? And then if you can also share just what it's like living in South Florida right now at the epicenter of the pandemic.
So the way our current governor of Florida handled the situation is abysmal. I'm sure he has a lot of pressure from all parts of the state, but we have to understand that, again, without a healthy population, there is no state, there is no economy, there is no government. We see that the foundation of this country are the essential workers, are the people who are working the front lines, and we have to protect them at all costs and protect the community at all costs. I wish they would have gone about it differently. I wish they would have mandated masks in public settings. I wish they would have maximized the amount of people in a place by 25% of the total people that could be in an establishment. I wish they would have closed down all the beaches, all the clubs, all the bars, all these non-essential businesses, and at the same time, allow them not to have to pay any sort of rent, any sort of mortgage, and allow their employees and employers to still get an income to sustain themselves again. That would have protected us, and that would have definitely saved a lot of lives. I don't know how viable or feasible this is, but I wish we could have also prevented state by state travel, because what we were seeing people from New York, when it was happening early on, March, April, they were flying down to Florida to get away from everything. And now we're seeing the inverse, where New York's numbers are decreasing and Florida's numbers are increasing. I hear a lot of people saying, oh, it's not that businesses are reopening. It's not that people are going to restaurants or going to the beaches. It's the protests, the protests, the protests, the protests. My response to that is there were protests in all 50 states. There were protests in more than 10 countries, and we weren't seeing these spikes all across the board. If the protests were really to blame, were truly to blame, If the protests were truly to blame, we would see these spikes all over. We're only seeing these spikes in places that have opened far too early and have not taken proper regulations and proper steps to ensure the safety of their community.
And so what do you see, you know, are there policies now or procedures and now in Florida, and then specifically in South Florida, and then just how has it been for you, you know, being at the epicenter right now of this pandemic?
As of today, I haven't seen any sort of new regulations being in place. I read an article yesterday where DeSantis said that he does not want to force a mandate of masks in public settings, which I think is erroneous. I think he should be enforcing this because we're seeing a decrease in places that have enforced masks in public settings. Living in South Florida, living in an epicenter, I am the last person to be asking because I don't really do anything right now. All I'm doing is going to work and coming straight home. I think I've been to the supermarket once or twice. I haven't gone out anywhere. I haven't seen any of my friends. What's sad about all this is I'm seeing more people driving. There's been an increase in traffic, and that's just telling me more people are out and about and more people are going back to work. And that's unfortunately going to lead to an increase because there are a lot of places who aren't forcing masks in the workplace, or it's not appropriate to be, or it's not viable to be socially distant from people if you're in a small office space. There's no way to be 6 feet apart from people at all times. So there are a lot of situations that can help prevent this, like staying at home. If you can work from home, do it. If there's a way for the governor to enforce these work from home laws, because there's a lot of people that I know whose jobs can be easily done from home, but their employers are forcing them to come in, and that's just unnecessary exposure for all people involved in that aspect. When I did go to the supermarket, I would say people were respectful of boundaries. Nobody was huddled up. The only people I saw like huddled up were like a family or something. In terms of lines, everybody kept their space. Everybody wore a mask. Some institutions, they would check temperatures. But again, more than 90% of people may be asymptomatic, so they may not have a fever, not even a low grade one. Yeah, I think at this point, we should be shutting everything down except the essential businesses. Clinics, hospitals, restaurants, supermarkets, that sort of stuff can remain closed, but nail salons, hair salons, barbershops, all these other inconsequential businesses really are not needed right now. I understand people want to go back to normalcy, but we cannot go back to normalcy until we address this issue right now. And the issue is this virus is taking over, and we need to do a better job at handling it.
And so are all facilities right now in South Florida open, or did they, open some and keep some closed, or did they close some again, kind of when they saw the spikes go back up?
So all my days are a blur right now. So I don't know exactly when they started opening and closing, but I do remember reading they had initially opened bars. And then when the spikes came back, they're like, okay, bars are closed. If more than 50% of your income comes from food and you sell alcohol, cool. If that's not the case and you're a bar, you got to close down. Um, I've been working the last couple of days, so I don't know too much of what else has been open and closed. But from my understanding, a lot of the restaurants are still just doing takeout only. And if they are doing any sort of accommodations for sitting inside the restaurant, it's at a minimum capacity. I don't know if it's at 25 or a 50. I'm hoping it's the former, but I don't know honestly. I wish I knew this, but I don't. Sorry.
That's okay. I guess, since you have only really been going to work and home, have you heard from coworkers or friends or folks as to what generally folks in South Florida have been doing? Have they been respectful? Have they been, trying to not be out? I know you said you've seen people go to work, but what has it been like for other folks that have been, more active being out?
So I have some friends who they exercise, they jog, they ride their bikes or skate. And there are groups of cyclists who there's like maybe 20, 30 to 50 at a time, all huddled up, and you don't see any of them wearing a mask. And that's so disheartening because they're perspiring, they're talking to each other, they may be like heavily breathing, and that's all just spreading the infection. Yeah, of course, you're exercising outside, and that's great. But if you're in close contact, it's really counterproductive at the end of the day. Um, from coworkers and friends that I've spoken to, they haven't had too many bad encounters with people. They will say there was one or two people at a supermarket or wherever they went that weren't wearing a mask or were wearing it inappropriately. Like, I wish I do have one. Want me to get the mask so I can show you how they were wearing it?
Sure.
Yeah. Okay. 1 second, please. So you should be wearing it like this. Wear like others would wear it like this, and others won't even wear it. So that's been an issue. I think just educating people on how to wear a mask properly is the best way. Teaching them about the alcohol use that's necessary, where it has to be more than 60%, is a good way to help reduce the spread of infection and hygiene in general. But there's only so much you can do, so much you can educate someone, because at the end of the day, we're all autonomous beings and people are going to do what they want to do.
Well, thank you for showing us proper mask etiquette. Just need to like screenshot that and have flyers.
Yeah. In terms of mask etiquette, by the way,
Oh yeah.
obviously this one, I'm not around anybody, so I could touch it all I want. People readjust it a lot. And what they don't realize is if someone's talking to me, any sort of droplet or vector that transports the germs lands here. And what people are doing is touching directly the germ site. What people should be doing if they want to readjust their mask, take it off from the side. That way, this is not exposed. And every time you're handling your mask, you should be washing your hands before and after, just to reduce any sort of spread of infection.
Thank you for that. I didn't know that, but I use the reusable ones because I've seen so many things now of, you know, the disposable masks just being laid out and stuff. And so I think that it's great that you're doing that project where you're trying to get the reusable mask, because it's definitely more cost effective and sustainable.
Oh, of course, for the environment, because as useful as these masks are, a lot of people use it once and throw it away. So I don't even want to read the amount of waste that's been going on because of COVID right now. I appreciate that people are using masks, but later down the line, we're going to see a lot of reports coming out of the environmental cost that COVID has affected this planet with in terms of pollution. Because I may be wrong on this, but I don't know if these masks are recyclable. The surgical masks and stuff.
Yeah, wow, that's super true.
Yeah.
So you said that you've mainly, you know, gone to work and then go home. So, you know, how has that been? You know, are you living by yourself? Have you kind of set down a routine now where, you know, have a routine when you come home, like from work? How has that gone?
So right now I'm living with my parents until I finish school and hoping to move out to get my own place. Financially, no one is in a state where they can live on their own. So I'm waiting until I get another job to move out. Can you repeat the other part of the, I'm sorry about that.
Yeah, you're totally
Yeah,
fine. I was just curious, you know, since you've just been going from work to home, you know, do you have a routine? Because I know some healthcare workers are very meticulous, right, about ensuring that especially since you live with family, you want to try to minimize exposure. So I just was curious if
oh,
you had a routine of like just dealing with your work things.
yeah, for sure. So before pre-COVID, I would come home, go directly to my room, take off my uniform, toss it in a hamper, like a separate hamper, of course, and go into the shower. Now my routine is I take off my shoes before I even get into the house. I go directly to the bathroom. I take off my uniform, throw it in a plastic bag, close that up, shower, and then I feel as though, okay, I'm clean enough to be able to interact with family members now. I don't pose I pose a minimal amount of risk for them right now. So that's been my routine. And outside of coming from home, what I'm doing on my downtime, since I'm really not going out, watching a lot of TV, binging Netflix, watching documentaries, reading articles about what's going on in terms of COVID, in terms of the racial injustices all across the country and the world right now, with the Black Lives Matter movement that has been exponentiated because of George Floyd's death recently and so many other unfortunate losses. And I've been occupying myself with that, and as well juggling school. So that's been where my focus has been. I know a lot of people are saying that there's going to be a mental health crisis because of COVID, because they don't have that human interaction right now. And I wouldn't be surprised if we see an increase in anxiety, an increase in major depressive disorders, and an increase in instabilities, either being mood disorders or adjustments, where people need to seek out treatment just for their mental well-being, because we are social beings. We are not meant to live on our own or be isolated. We are meant to interact. And I'm sure that this isolation and quarantining in all aspects of the word is affecting people negatively, unfortunately. As much as we need quarantining and need the isolation to help reduce the spread of this infection, we are also seeing a negative side of this. It's not a simple black and white issue. there are shades of gray, and it's a complex where we have to address both the mental well-being of an individual and the physical well-being of an individual.
And so for folks like yourself, like healthcare workers, how do you see that mental health concern looking differently for you all? Because I know, like you said, you are just going from work to home, and I would imagine that being the case for many healthcare workers. So how has that been for you? And I guess, how do you feel like that is maybe that level of concern is increased amongst the healthcare professional population?
Um, it's daunting for us. The fortunate side is I spend 12 hours a day with my coworkers. Eventually, you're gonna form some form of friendship. So at least I get to see people on that level, but it's not the same where if I go into work, I'm in a work setting. I can't do all the things I would want to do if a coworker and me were to go out somewhere. So I appreciate the fact that I'm able to converse and interact with my coworkers, but it's still in such a limited setting. And speaking to other healthcare providers, ranging from healthcare technicians, assistants, nurses, providers, and therapists, their routines look similar to mine, where they aren't really doing too much and they're just focusing on going to work and staying healthy as much as possible. A lot of people would love to travel. A lot of people would love to go out and get away from it all, so to say, but we are not in a position where we can just get away from COVID. This is everywhere. And even if we were to go somewhere that's not inhabited by a lot of COVID patients, or there's not a lot of spikes going on in that area, we're still risking bringing the virus to an area that's not heavily populated and risking exposure for them. And that is something that people have to be aware of, because you're in Miami, say you've been safe, you don't feel anything whatsoever, but for some reason you have the virus, asymptomatic, and you have the virus. Say you say, I feel good, let me go to this small little town. There's no risk right there. Say you go to a restaurant and you're good. You just infected a lot of people, unfortunately. That's why I really love that limitation of travel for people on a state by state level and even on a county level, because we're seeing differences in regulation. Like I remember that I think in Jacksonville, they had opened the beaches in that area. And a lot of people from South Florida flocked up over there and said, oh, those beaches are open, I can go to them. And then when they come back down, the infection that they brought from over there spread over here. And that can go for any way direction, whether it's people coming to Miami or people leaving Miami and spreading the virus over there. So I think as much as people want to travel, as much as healthcare providers want to travel, as much as we want to get away from everything, we need to do our part. We need to be cognizant of other people, and we need to be aware of what's going on.
And you had talked about the differences in regulation by county. Are there any other just differences in amongst the state or county level, since Florida's pretty demographically different,
Yeah.
where you're at, and so if you can speak to that based off of what you know.
Um, I know the mayor of Miami, and I believe Broward County in general, started to institute mandatory face covering when you're out in public. I don't know if that's widespread. I don't know how enforceable that has been. I don't know if it's reached other parts of Florida, but in terms of Broward and the city of Miami, I've noticed that people have been respectful towards that. I think partly because of the new regulations that were in place, but also because things have gotten so much worse here. I believe it was Sunday that we had 15,000 new cases. If we compared Florida to other countries all over the world, I think we were third or fourth uh, that day. And then we were number one across all the United States. I think we had the single highest cases of COVID positive patients out of any other state throughout this whole pandemic, starting from January to now in July. So Florida is number one for the worst reason right now. And like you mentioned, we are considered the epicenter right now. There are some reports saying that Orlando is the epicenter because of what's going on with the theme parks, which I think it's ridiculous that they opened the theme parks, because for anybody that's been to Florida, you cannot be wearing a mask for 12 hours in heat. You're gonna sweat through it. Your mask is not gonna hold up in that temperature. You're not gonna be able to socially distance yourself from other people because it's it's chaos right now in any sort of theme park. People are going to be bumping into each other. You're going to be in lines. There were stickers placed on the floor. I saw pictures, but then you'll see like 10 or 20 people just huddled up right there, not socially distant whatsoever. So that's where I'm leaning towards, where I think Orlando may be the epicenter of Florida, but others are saying that Miami is the epicenter of Florida just because we have more positive cases. But I think people have to realize that we should be looking at percentages, because obviously Miami may have more cases because we're just so much more heavily densely populated. But if we look at percentages, that may be able to reflect where the problem really is.
And so from what you've seen as a health professional, you know, and since you're in South Florida, what has been like the demographic for most cases? I mean, I'm sure you maybe can't say specifically, but maybe generally like the age range or the demographic of patients that have you know, been seen in the hospital as COVID positive.
I can't speak to North Florida, but in terms of South Florida specifically, initially the age group was, I think, 45 to 65 and up, where we were seeing those individuals with COVID positive cases that were being sent to the hospital. Now we're seeing a lot of cases where people in their 20s and in their 30s and their early 40s are showing positive and showing devastating symptoms that need hospitalization. We are seeing patients who are 22, 23 having to be intubated because their body is just shut down completely. So I think it's a fallacy where people say, oh, if you're young, you're not going to get sick, you'll be fine, you'll just have a cough. No, there are people who have no pre-existing conditions, and this virus is absolutely devastating to them. That actually reminds me right now that Florida is saying that they want to open schools at 100% for fall, where they want teachers to go into the school and teach face to face and all this sort of stuff. And I think that's going to be absolute chaos. People are saying kids can get infected. They aren't the primary hosts for this virus. But what people don't understand is, okay, kids primarily may not be those being sent to the hospital, but they could still be carriers. They could still be carriers that infect their teachers, infect other adults working in the school setting, infect their parents, infect the bus drivers, infect the cafeteria workers, infect security. Um, they may not get sick, but they can get everybody around them sick, and that's just going to lead to a disaster. I think we should remain with remote learning until the end of the year. I know the argument is that children do need that physical face-to-face contact with teachers and their friends in order to develop. And I agree, but considering the pandemic that we're in right now, it may not be appropriate. And I think 6 months to 12 months of informal education is a better alternative than risking more infections and more death uh, across the country, and specifically Florida.
Yeah, that's very disheartening that they are still going to go forward. So you said that, you know, at the beginning, the age demographic was a little different than what you all are seeing now. So, you know, do you know why that is? Can you, I guess, from your perspective, why do you think that is?
Um, Initially, it was those who were immunocompromised, those who had comorbid issues, and other factors that made them susceptible to the infection. And I think now more people are just interacting. They're hosting parties, they're going out to clubs and bars or to the beach and restaurants. And it's just infecting everybody now. It could be mutation. It could be that people are more lax in their approach to the virus. They may not be wearing their mask appropriately. They may not be socially distancing as much as they can, and that's part as to why we're seeing a rise in the infection. But I really don't have a solid answer as to why we're seeing more young people being infected. I'm sure there are articles out there, and I'm sure there are individuals who have spoken at length at this, but there's just so much information out there. It's overwhelming, and I can't remember everything. Sorry.
Nope, that's totally okay. Um, but I guess also thinking ethnically and racially, what has been the demographic of patients that you all have seen throughout this entire time?
Majority, because I am in Miami, have been Hispanic people, Latinx people from across the board, and Black people as well. Uh, I think the numbers were that Black and Latinx people were 2 to 3 times more likely to get the virus, and the severity of their symptoms and the debilitation of this virus was more severe with them compared to white people. Um, I didn't read, or more so, I don't know if there's a lot of information out there comparing the racial disparities between Asians, indigenous individuals, those of mixed races and stuff. But I'm sure the numbers are out there or will eventually be out there so we can see what the issue is and why certain racial demographics are more susceptible. I mean, I could speak to it in that there are more Black and Latinx people who have comorbid issues that they don't seek out medical care because of biases and discrimination, and because of the fact that they may be on the lower side of a socioeconomic status. So all these culminating factors are an influence as to why they may be more susceptible and the symptoms may be more severe with them. There could also be a slew of other biological reasons to genetic reasons that is outside my scope of practice. So um, it's an interesting thing seeing a pandemic and living through it, because prior pandemics, like the Spanish flu back in 1918, we've only read about it. So we can see like from start to finish and see the progression of it. Right now, we saw the start of it, but we have no end in sight. So we don't know what the long-term consequences of this virus are going to be. We don't know the hereditary factor. If you were infected with COVID, what's the potential that your child may have some abnormalities? If there's a risk for infertility, if there are other associated risks. So that's going to be interesting to see in the next couple of years or decades, and to see the amount of research that's going to be coming out, which hopefully can help us navigate future pandemics and respond appropriately.
And you spoke about how you were sharing how Black and Latinx people were those, more likely to get the virus, and just, if they get it, it might be more severe. Can you speak more to that? And you spoke specifically about, those folks not really wanting to seek treatment, or potentially not wanting to seek treatment. And so if you can speak more to that as well.
So with people of color, on a lower socioeconomic status side, they don't really go to outpatient settings because of the costs. And there is a perception where an outpatient setting may not adequately help you with your symptoms. So they would rather go to an ER or to the hospital, where they would get their medication management or their treatment management there, which unfortunately doesn't offer any sense of continuity of care. Because if you go to an urgent care, it may be the same one, but they're always cycling through staff, as opposed to an outpatient setting where it's typically a 9 to 5. There's going to be a consistency with the staff that you're seeing. So that could be a potential part as to why there's a disparity in health with Black and Latinx people. Another factor could be as well, I mentioned that there's a lot of comorbid issues with these two specific groups of people, whether it be diabetes, hypertension, or any other form of like a metabolic syndrome, which includes high cholesterol, a higher BMI, a diagnosis of obesity, which in turn leads to cardiovascular issues, respiratory issues, and that could also affect renal and hepatic systems. And all that are organs that the coronavirus affects directly. We've seen it deal with circulation, so that deals with cardiovascular and pulmonary. We've seen it affect liver function and kidney function, where people have to be placed on dialysis. Um, we've seen it in terms of cardiovascular circulation issues, clotting factors, where people are getting clots either in their lower extremities, where they would possibly need to get amputations, or the clots are found closer to the brain, where it would eventually lead to a stroke and leaves them incapacitated. So this virus just affects all these major organs, and unfortunately those major organs are where Black and Latinx people are more predisposed to having health issues with, as well as in terms of psychiatry. We're seeing patients who are on antipsychotic medications that play a part in the metabolic syndrome that patients experience, where there is an increase in cholesterol, an increase in BMI or body weight, and all these things. So you have health issues that are on a physical level, and you have health issues that are on a psychiatric mental level, are all bringing people down, because this virus is just so widespread and just attacks everything, and we just cannot keep up with it right now. Of course, we made so many advances in the last 4 to 5 months, but again, we don't know half the things that are going on right now.
And so based off of, your experience, both as a student and a practitioner, why do you think that it is more likely that these communities have these conditions like diabetes and hypertension, or, these folks might be more excuse me, more inclined to use the psychiatric medicine, as you were mentioning?
Um, so a lot of it has to do with culture. a lot of cultural influences where in the Caribbean, people may not seek out a provider. They may seek out like a curandela or I don't know the exact translation, but like a witch doctor that they can help alleviate their symptoms with herbal remedies or alternative or complementary medicines. And while that is appreciative and amazing because a lot of complementary and alternative medicines do help people, there should also be a reinforcement of westernized medication or treatment options that can combat these issues, that can help regulate individuals' diet, medication, and overall lifestyle. There's also accessibility of care. Again, Black and Latinx people in South Florida, Miami specifically, a lot of them are on the lower end of the economic spectrum. So they may not have the ease of going to the doctor or taking a day off to go see their general provider, or a lot of them may not have a primary care provider, and they're so reliant on these urgent care and emergency rooms for treatment because they don't have that consistency. And that's where, going back to what we originally spoke about, where telemedicine actually comes into play and can help combat a lot of these issues, where you can have some consistency with a provider and you can have that accessibility that is within your means and that hopefully your insurance covers. If we lived in a perfect world, or rather a better world, where your insurance wasn't so heavily reliant on your income or reliant on your employment status, everybody can have access to health across the board. But unfortunately, we in this country are seeing necessities and turning them into a profit business, whether it be health, whether it be academia, whether it be housing, and so on.
Thank you for sharing. And so, you do you feel like COVID has, in fact, it affected? Sorry, let me start again. Do you feel like COVID has affected how you feel about your career choice? Because you've talked about, how difficult it has been and just frustrating in general. So do you feel like it has impacted, your decision making?
Um, it hasn't. I think I chose a career where I feel satisfied and grateful that I can make a difference in someone's life. Um, I'm fortunate that psychiatry, more so than other specialties, can be extremely well matched with telehealth because unlike physical therapy or occupational therapy or a general provider, I don't have to have too much physical contact with the patient. I may have to notice if they have any sort of tremors or if they've gained weight or if there's any other issues that I may not be able to see on a computer just because, like, again, you don't see the lower half of my body. But I think I chose the right career for myself because I'm still able to do my part. And even in the future, if COVID stays around longer than we anticipate, I'm still able to treat people from wherever because of remote access, which has been incredible. Um, I will say it has been disheartening where in the beginning people were praising healthcare workers and saying nurses and doctors um, wear scrubs and that's their superhero cape and we have to respect them. And then a couple of weeks later, people are just, I guess, slapping them in the face saying, oh, I don't need to wear a mask. Oh, I don't need to care about this because it's a hoax or it's not that bad. And it's just super disrespectful towards healthcare providers who are on the front lines, who have been doing testing, who are taking care of these patients that are dying, that are risking their lives for everything. but I like the field that I'm in. I'm excited to graduate. I'm excited to work as a nurse practitioner and be able to navigate a patient's treatment regimen, um, and work together with patients in the future on a whole new level compared to how we initially viewed nursing and providing care 10, 15, 20, 30 years ago.
Thank you. And so I want to be cognizant of your time. So I just have one more question. Is there anything else you wanted to share with me about your experiences with COVID, both related to work or not related to work, that I've not asked you about?
I think people have to be mindful that although you may not know someone personally who has been affected by this virus, um, that it is not fake, that this is something that's very real. More than 130,000 people in the United States alone have died. More than 500,000 people around the world have died. And while we are attributing those cases to COVID-related causes, we don't know the long-term consequences of this virus. We don't know if down the line it can come back. We don't know how long the antibodies will last in your body. We don't know if an aneurysm 2 years from now was a result of other health issues or was it an underlying issue of COVID? And that's where people have to realize this isn't just a respiratory issue. This is a whole body issue. It's affecting every part of it, and people have to be mindful to that. And people have to be respectful. If someone tells you to wear a mask, wear a mask. And even then, it shouldn't take someone telling you to wear a mask. You should wear a mask to protect yourself and protect others. I'm seeing a lot of things on social media saying, I shouldn't wear a mask. It's my freedom of expression, all this sort of thing. And I compare that to how it was back in the early 20th century, where people were saying, "Oh, I don't need to wear a mask." There was an anti-mask coalition going on back then that we're seeing now again. And someone compares it, secondly, to seatbelts, where there was regulations for seatbelts back in 1970, and there was so much pushback, and now everybody wears. Majority of the people wear a seatbelt, and I feel as though why are people so adamant to not protect themselves and others? And unfortunately, I think it has to do with the mindset of those that are being led by this current administration. And hopefully, in the future, we can move away from turning a pandemic into a political issue, and we should be seeing it as a public health issue and having policy and procedures protecting the people at the end of the day. Um, I just hope for the best. I hope this vaccine comes out soon, that it is viable and safe for people, and it is something that we will be able to combat and look back and say, we were able to overcome this pandemic, and future pandemics we will be able to overcome as well.
Well, thank you so much, Topher, for sharing your experiences with me today and talking to me about everything relating to work and public health and beyond. And we really appreciate your time and your contribution, because your interview will be viewed by people looking back at this time.
Awesome. For anyone watching this or hearing this, reading the transcripts, I really want to make one thing clear because of the racial injustices going on and how this virus is affecting Black people, Indigenous people, and people of color more than other races. I just want to say that all Black lives matter. and that we should be doing everything to ensure that this country is free for everyone and not just a select few on top. And hopefully we can move towards a more progressive world where we can look back and say, we fought this and we are able to overcome and move on as a society as a whole.
Thank you, Topher. And I really appreciate you as a healthcare worker being a big help at the front line, supporting people getting better during this pandemic.
Awesome. Thank you so much for interviewing me. And I hope people utilize this information and make the most out of it. And thank you so much for making this whole project revolving around Latinx voices, because a lot of times in research, it's very white centric, and it doesn't allow for the voices of people who are not white to have a say in what's going on.